You're listening to Just a Pinch podcast with Injector Kristin. Join me and industry experts as we discuss the good, the bad, and the ugly of the aesthetics, wellness, and fitness industries. Welcome. Thank you so much for tuning in and listening to episode 1 of Just a Pinch podcast. My name is Kristin Gemme, and I'm a physician assistant, and I've been a licensed physician assistant for over a decade now. And for the past 5.5 years, I've been working full-time at Radiance Med Spa in Avon, Connecticut. To give you a little bit about my background, I come from a history of primary and urgent care, and also spent some time in the surgical trauma critical care area in Hartford, and most recently in aesthetic medicine. When I'm not at work, I love to cook, to read, listen to vinyl records, watch movies, and definitely listen to podcasts. I used to be an avid fitness enthusiast, and I say used to because I can't do what I used to do anymore, and it kills me a little bit inside. But I had at one time earned my USAW Olympic weightlifting coaching certification and even coached others. I used to do CrossFit back in the day, lots of strength and conditioning, got out of CrossFit, got more into the Olympic weightlifting side of things, and then moved out of Olympic weightlifting when I had a back injury in 2016. So I had to take a lot of time off of training and just trying to rehab my body and get back to being able to just move without pain again. So since then, my goals have changed. I've been working on just being able to rebuild a healthy base and just be able to continue to train and be healthy. It's not so much anymore about lifting the heavy weights or PRing or maxing out or being better than everybody else. At this point in my mid-30s, it's just about being able to move and being able to be healthy and to be able to continue to train. So that's my background in some fitness-based things. Now, one of my favorite things to say is if you're not fluctuating, you're not living. Now, take that with a grain of salt, because if you talk to all the fitness experts out there, they're going to be shaking their heads at me. But for me, it's all about balance. And I think balancing everything in our lives is so important. You know, you need to be able to go out and have that cheeseburger or have that big bowl of pasta and also be at the gym and take care of yourself. So all about balance with everything. So currently I'm actually following the Power Athlete programming. I really enjoy it. It's very well-rounded. It's strength and conditioning based, and I like it because it's scalable and it really fits into my schedule. I can do different workouts on different days based on what works for me. And you can find them powerathlete.com. Love them. All right, so time to circle back to aesthetics. So I work full-time in a busy medical spa in the beautiful Avon, Connecticut. We do everything there. So I perform neuromodulator treatments, aka Botox, Dysport, Xeomin, dermal fillers, biostimulators, PDO threads, all sorts of different types of lasers, Ultherapy, Vivace radiofrequency microneedling, skin pen microneedling, hair restoration, everything with PRP and PRF. We do medical grade skincare, body contouring, and more. We have a full staff. We have full-timers, part-timers, per diem. We have medical assistants. We have medical estheticians. I'm the physician assistant there and the lead. We also have a nurse practitioner and a registered nurse. And our medical director is Dr. Stephen A. Brown, a board-certified plastic surgeon. So a lot of people like to ask me, what's your favorite kind of appointment? What do you like to do the best? And I really don't have a great answer for that because there's not one particular treatment that really pulls me in. My favorite type of appointment is one where my patient allows me to take the reins within their budget to balance and refresh them with different modalities. So not just coming in and just doing Botox, or coming in and just getting your lips done, or coming in and just getting a thread lift. I like to do a little bit of everything, because when you do a little bit of everything, it's going to give you the most balanced, natural, long-lasting result. So my favorite type of appointment is the one where my patient fully trusts me and allows me to take the reins and guide them within their budget to reach their goals. So that would be my answer to that one. All right, so what can you expect from Just a Pinch podcast? So you're going to hear a little bit of everything. My goal with this podcast is to keep things really well-rounded. You're going to hear plenty of solo episodes with just me, and then I'm also going to bring in industry experts from whatever topic we're covering that day. You're going to hear from fitness experts, people that know a ton about nutrition and wellness. We're even going to bring in some hair people, because hair is very closely related to our skin and our scalp. And we're going to learn some really healthy ways to take care of your hair and how to be healthy from the top down. We're going to be discussing a lot of different treatments that are offered in the aesthetic industry, many of which I already mentioned above. And it's really my goal to educate you. I want you to be educated beyond what's listed on the consent form that you're signing before a treatment. I feel, after speaking with so many people over the years and my patients, a lot of people, and it's at no fault of your own, are really uneducated in the world of aesthetic medicine and treatment options. And it's kind of our fault that, we're not taking the time to really, really, truly educate you on all the things. And it's because we just don't have the time. We cover the most important things that you need to know to feel confident signing that consent form. But this podcast is meant to fill in the gaps. I want to give you a little peek behind the curtain of your aesthetic provider's brain and why we're choosing the treatment options for you, the ones that we're recommending, and why we're recommending certain things and why we're saying no to other things. I think more important than somebody that says yes to you is somebody that says no. And I think that we could all use some more no people in our lives, especially when it comes to aesthetic medicine and treatments and injectables, because these things aren't to be taken lightly. Everything comes with risks, and everything can affect, how you're aging and how your skin looks and how you just aesthetically look for a long term. Even some things that are, dissolvable and technically temporary, they still affect us. And I want you to be able to know all of those things. So next up, we're going to kind of chat about aesthetic and beauty fads and trends. We're going to talk about the things that you're seeing popping off on social media. We're going to talk about the impacts that social media has on aesthetics and how celebrities are influencing what we're doing. We're also going to talk about how to choose the correct aesthetic provider and practice that fits your needs, your budget, and is most of all safe. Just because somebody has 100,000 followers on Instagram, it does not mean that they are licensed. It doesn't mean that they're safe. And we have a couple examples of that have happened just this year on social media. And it came to light of these places that, look like they're these busy, bustling, super popular practices, and they are so dangerous. So we're going to talk about all those things. When it comes to fitness and nutrition, I want to talk about how they're a super important piece of the puzzle when it comes to your healthy aging. I have several guests lined up from near and far that are some of the smartest people that I know in their respective fields. The gym can be a really overwhelming and intimidating place for so many of us, and it can be really hard to know where to start or what resources are even available to help you. We're also going to be bridging the gap between aesthetics and fitness and spend some time talking about the very emerging world of medical wellness. So not going to your primary care doctor, not necessarily seeing somebody for Botox, but wellness. So that's going to involve things like peptide therapy, medical weight loss, vitamin shots, IV therapy, and biohacking your way to the best version of yourself. So no topic is too hot, and every conversation will be unbiased. This podcast is not sponsored, and all the opinions stated on this forum are quite literally just that. They're my opinions and the opinions of the other industry experts that we're going to be chatting with. I welcome all of your questions and feedback. I encourage you to participate by submitting your questions to me. You can do that via email at justapinchpodcast@gmail.com, or please feel free to send me an Instagram DM. The Instagram handle is at justapinchpodcast. Don't forget to rate and subscribe and turn on notifications so you never miss an episode. Thank you again so much for listening, and be sure to tune in next week when we dive headfirst into some injectables talk. Just a Pinch podcast was written, recorded, edited, and produced by Kristin Gemme.